For the last 3 years, 40-year-old Nora Nanziri, a resident of Kizungu in Makindye, a Kampala suburb, has lived in fear of seeing her life slip away after she was diagnosed with colorectal carcinoma cancer that affects the rectum. Even after trying her best to ensure she doesn't succumb to the deadly disease in 2011, the renowned food vendor in this area could no longer carry on with her job after complications intensified. Experts say cases of colorectal cancer are rising dramatically due to economic development and industrialization. It's the third leading cause of cancer death in all gender in the United States, but less prevalent in Africa. Scientifically, cell carcinomas may develop in the transition area from the rectum to the anal vag and are considered anocarcinomas. Carcinoma is the medical term for the most common type of cancer in the humans. But very few cases of squamous cell carcinoma of the rectum have been reported in Uganda. So what causes these cancers?
A gene will pass over to you. So in case any of them have that defect within their gene, you will end up with it. This type of cancer is more common in the Western kind of settings because of the kind of diet, low starch, high fat. And in our culture, we are starting to adapt to the Western kind of diet.
Approximately 20% of colon cancers develop in the rectum, leaving the patient like Nanziri with continued flow of fluids from the rectum. After an operation, she sought assistance from Hospice Africa Uganda in Makindye to help sustain her life. The help came in form of 3 drugs, but she complains of the effects of the drugs, although she has some relief. Many people like Nanziri cannot afford such treatment, leaving them to die early. But palliative care is recommended for such people. It is an approach that improves the quality of life of patients associated with life-threatening illnesses through non-medical relief of pain. Uganda is now a model for palliative care in sub-Saharan Africa. Palliative care is covered in both the National Health Sector Strategic Plan and the National AIDS Plan. These services have increased significantly since introduction in 1993. Early next month, the Minister of Health will launch a report on the development of palliative care in Uganda. Zahra Namuli, NBS Television.